Well, there's a new study out revealing that folic acid may actually reduce the risk of stroke, especially in hypertensive patients. Researchers presenting their work at a medical conference this week in San Diego. These findings especially critical since strokes are a leading cause of death here in the U.S. Dr. David Samadi joins us, chair of urology at Lenox Hill Hospital. Good to see you.
Good to see you.
All right, so pregnant women take folic acid, and studies have shown that's good for them. But what about this study here that it reduces risks? Is this a good study, medically speaking?
We like this study because for many reasons. One is the fact that they have about 20,000 participants, which is great for this particular study. They followed it for about 5 years. And what they did was they divided the two groups into 10,000 people, took folic acid and something we call ACE inhibitor. And the other group only took the ACE inhibitor. So the only factor was one group got the folic acid, the other didn't get it. And they followed them for about 5 years. They found out the group that actually took vitamin B or folic acid, Greg, they had a 21% lower chance of first-time stroke, which is significant.
Right.
Now, should everybody out there who has high blood pressure go out and start taking vitamin B or folic acid? The answer is no. We want you to talk to your doctor. Obviously, all the vegetables that you see on the screen, you can get a lot of vitamin B from lentils, from nuts, from veggies, etc. So having a balanced diet is important. But if you're at high risk, if you have high blood pressure, high risk for stroke, cut salt out of your diet. That's the first thing. And talk to your doctor and see if this will be helpful. Presumably, it reduces homocysteine, which is a prefactor for stroke. So I like this study, and I think if you don't take vitamin B on a regular basis, get one of these multivitamins that has vitamin B in it.
Okay. All right. Now, that's vitamin B. I want to switch to vitamin D because there's a new study out that said D is in dog, by the way, not B, that vitamin D doesn't help reduce high blood pressure?
So this is the first time that we're getting sort of like a surprise negative study on vitamin D. We've spoken about vitamin D all the time when it comes to multiple sclerosis. In my field of prostate cancer, we said that it may reduce that. So vitamin D has been around for healthy for your bone, etc. In this particular study coming from Scotland, they're basically saying that if you're taking a lot of vitamin D, it may not help you with your blood pressure. How much vitamin D should you be on and what should be your level? We think that somewhere between 30 to 50 is a good number for everyone out there. A lot of alternative doctors keep saying take vitamin D, but too much of it is not going to really help you, and it can increase more and more side effects and issues. So number one, check your vitamin D level. You can ask your doctor, find out what it is. It should be around 30 to 50, and if you need supplement, you can take it. In this particular one, it's not helping so much with the blood pressure, to lower the blood pressure, but I think overall vitamin D is absolutely essential, especially for you and I, because we don't get enough sun. And I can't believe it's still snowing out there in March.
Yeah, I can't believe it. Well, listen, it snows here in April as well.
Exactly.
But look, a lot of people, especially in the Northeast, because of the sun, lack thereof, take a lot of vitamin D. What are some of the negative side effects that could happen if you take too much of it?
So I personally take about somewhere between 1,000 to 2,000 units a day.
Do you?
Okay, and I always monitor my vitamin D because when it's really low, you feel fatigue, you're tired, you just drag. And when you fix it, all of a sudden you get your energy back. If you take too much of it, the risk is maybe you will get kidney stones because now you absorb a lot of calcium and you may have problems with that. Always talk to your doctor, check your vitamin D.
Good advice, Dr. David Samadi. Thanks
so
much.
Thank you very much.